Hey Liz, remember when we didn't think we'd have something to talk about this week?
Yeah, I remember we were planning for the end of the year, like it's going to be chill. Nothing will happen.
That's because nobody saw the French Revolution coming to the US.
I did not. I did not have that on my bingo card. But let's talk about it.
Yeah, let's do that.
It's been a wild few days with what happened in New York this week. I want to start off this episode with a disclaimer. We are not condoning violence. I just want to say that I feel like everyone who's talking about this has said that. We're not condoning any violence. You know, CEOs deserve to live too. They're people just like us. And so we want to say that because we may make a joke or two and you may take offense to it. And if you do, my apologies. But this is kind of funny in a way. Kind of funny, wouldn't you say, Olu?
Well, yes, but I think that's because of all of the factors that have brought us to this point, right?
Right. This is not an isolated incident.
Right. And one of the things we would sort of like to do is to explore the multiple, issues in our society that has led to this particular outcome, in my opinion, right? And just how, in general, we have to run our societies better if we do not want people acting out like this, right? Like,
yeah,
vigilante like this.
Yeah, it's funny because within a day of this happening, it really brought back to mind, and I texted this to you, it brought back to mind how people were reacting to the Titan sub. Right? There was a lot of, ooh, millionaire, billionaire goes missing doing millionaire, billionaire thing. Oh, well. And this kind of feels like, I was calling this, like, the public reaction to this. I said I was going to say this on the episode because I want to get it out there. I was calling this, like, Titan Submersible 2 Electric Boogaloo. Because, like, we are back at where we were July 2023. Was it July? I can't remember. Having a conversation about rich people doing things. Except now it's not rich people, going to see the Titanic and injuring just themselves. We're talking about the CEO of, I think it's America's largest insurance company, right?
Yes.
We're talking about him being assassinated, basically.
So, where do you want to start?
I think let's start with, before we talk about, like, the issues with the system, the actual assassination. Let's start with the response, both from people in the public, but also the media. Because you and I, over the last few days, have seen coverage that just made us roll our eyes, right? Yeah. CNN has been doing this, like, they brought out people that went to, the CEO's name was Brian Thompson, the CEO who was murdered. They brought out people that went to his high school, telling us what a great guy he was. And I just thought, okay, like, that's cool. Of course he went to high school. I mean, you don't graduate from college and get a job at an insurance company without going to high school. So of course he did. But what about the very valid concerns people have about the work he did and how that might have contributed to what happened this week in New York City? But the media coverage has been very disconnected from how people seem to really be feeling.
Exactly. They've been doing this segment like, oh, he rescues puppies and, like, created rainbows. And it's like, okay, sure. I'm sure there are people who love him deeply and our heart goes out to those people. But then there are also people who love their parents, who love their children deeply, who, like, love their own lives too very much, that he has affected, like, negatively. And this is something that we keep talking about. People's lives are precious because they are precious. It doesn't matter what they are to society. Your life is precious because your life is precious. Whether you know, a CEO, whether you graduated high school, whether you were valedictorian, whether you were a star athlete, doesn't matter. Your life is valid because it's valid, and somebody shouldn't be able to gun you down in the middle of the street. And also, somebody shouldn't just like plug an AI algorithm and deny you brain surgery, right? Like, these are things that we should all be able to agree to as a society.
Yeah, and to the point about, people's lives are precious to their family members. We understand that there are kids here who lost a dad. Nobody is arguing that. The problem, I think, and what's happening in the disconnect between the media and the public, to me, it seems like the media is just glossing over his job and the real, like, evidence that this is the reason why he was attacked. And to even further sort of highlight the work that he did and why this is part of the story, the CEO of United Health Group, who just explained to me sort of how UnitedHealthcare works. So there's UnitedHealthcare, which is what you think about with insurance, and then there's United Health Group, which is a larger company that owns UnitedHealthcare and Optum.
And they also have like outpatient clinics, and
exactly,
like, they have their hands in essentially every single part of healthcare in this country. They insure 52 million people, which is like another huge problem. Why, in a capitalist society that is about competition, why are we allowing one single company to insure, 15% of the population, 20% of the population? That's insane, right?
Yeah, exactly. And the United Health Group company has its own CEO, who is like sort of the master CEO over the second tier CEOs. I don't know. Brian Thompson was CEO of United Healthcare, so he reported to this guy. This man, Andrew Whitty, he was doing a call where he was kind of explaining in the aftermath of what happened. And of course the video call leaked because I don't even know if people at his job are taking him seriously right now. But the call leaked, and we have some quotes from him about the work that they do. He seems like he's in defense mode. He's being very defensive. He said the United Healthcare companies will continue to, quote, guard against the pressures that exist for unsafe care or for unnecessary care. And that really struck me because he seemed to be positioning them as a protector of patients from all those evil healthcare professionals that are trying to recommend unnecessary surgeries or unnecessary medication. They're trying to save the industry by stopping doctors from prescribing too many drugs. And yet there are thousands of stories of people who needed life-saving medication, and United Healthcare declined to provide it. I talked to people I know that are actually medical professionals that are doctors. Every single one of them had stories about United Healthcare specifically denying their patients care because, they're just trying to save money. And it's fascinating to hear that the sort of CEO of the company feels like that's how he justifies the work they do, is they're protecting patients. That was just so interesting to see.
But like this is again like the selfishness of people, right? Because that guy wants you to believe that other people do not deserve the money that they are charging for their services. But that guy makes like $25 million a year. And he clearly does not believe that he does not deserve $25 million a year, right?
Definitely
And
not.
He thinks he deserves his shares and he deserves his bonuses, and he thinks he deserves to sell his shares when it's conveniently looks like insider trading and the DOJ is like investigating that. Like he's presenting himself as this victim. Meanwhile, like they are making money hands over barrel. So like it's not it's not even enough that like you pay UnitedHealthcare your premiums, and insurance companies in general, you pay them your premiums, but then your employer also matches your contributions to your healthcare, right? So that's two buckets of payment that they're getting. Then the government actually pays insurance company like UnitedHealthcare to run parts of their Medicare programs. So they run that too. And then in addition to that, like actually you have to pay deductibles. It's not enough that you paid your premium. You have to pay dollars in your deductibles before your actual like healthcare rolls in. So they're getting money from you again a second time. And then come December, they're like, oh, actually, it's the end of the year. Let's wait until you have to pay deductibles again to give you your care. Like, it's this Kafka-esque, like, Ouroboros of chaos.
You said Kafka-esque.
No, but, like, I mean, how else can you, like, describe it?
That's valid. It's valid.
This Andrew Whitty guy and, like, actually, I don't want to like single him out. Let's just talk about like the health insurance company itself. Like they get to lecture us about efficiencies and costs and excesses. Meanwhile, they're like making money out of like 5 to 6 buckets that I just listed, and I'm probably not covering everything where they have their hands in the till and they're making money from.
Accurate. And I don't know if you, I know we're trying to talk about healthcare in general, but I don't want to gloss over UnitedHealthcare specifically, because I don't know if you saw that chart that was circulating online about claims and who denies the most claims of all the sort of major insurance companies. And this chart that was going around had UnitedHealthcare denying about 32% of their claims, when the industry average is around 16%. So UnitedHealthcare is twice the industry average of denials, which I'm like, that is a lot. 32%. That's a third of claims. That means if you have UnitedHealthcare, you have a 1 in 3 chance of getting your claim denied by UnitedHealthcare. I know we don't want to single anyone out. If you're curious, as a listener, the insurance company with the lowest denial rate, according to this chart from LendingTree, was Kaiser Permanente, which is like
is run by physicians mostly.
Right, it's a physician-run insurance company.
Yeah.
So, FYI, I guess if you have an option, you can change. I think the only downside of Kaiser is the network isn't as large. I don't think they're accepted in as many places, and that's probably part of why.
Yeah.
But UnitedHealthcare is especially egregious when it comes to denying claims. And so I think that's part of why this is causing so much churn and conversation, is everybody has a story. Everybody has a story. And you shared one of those stories with me that was published in HuffPo, I believe.
Yes. This is a story in HuffPo that her mother wrote about her daughter who's been going through a condition called Ehlers-Danlos, and the main gist is that it's caused the brain to sag, and her daughter has had this pressure on her brainstem now for years, and her daughter was referred for brain surgery in a specialized center, right? Because like not all centers will have the specific expertise and also the specific sort of equipment and, technology to actually do the kind of surgery that they needed to do. And they were given a date of September 26, she said. And on September 20, her insurance company sent them a letter denying the operation and then giving them a list of local neurosurgeons in her area who actually did not have the expertise and didn't have the resources or didn't have the capabilities for whatever reason to do that care. This person saw a neurosurgeon in her local area who told her this is where the actual expertise lies, go over there. And the insurance company had the gall to be like, no, actually, we know better. Go to this local neurosurgeons who already said they can't do it. I mean, this is insane. It's an insane story. And it just underlines, like, you know, that lady says she's furious, right? Like, if somebody is that furious about, like, their own daughter who's been sick for more than 7 years now, unable to, like, even, like, clean her own room, unable to go to Target, you might understand why that person may not be, like, willing to shed a tear for this other person who got gunned down in the street in a, like, vigilante, surreal way. But, like, this is what happens when you dehumanize people. They dehumanize you back. I don't understand how else we think this was gonna end anyways.
Yeah, and that story you're talking about also highlighted the reporting that's been done on how companies like UnitedHealthcare make the decision you're talking about. So how did we decide that this neurosurgeon recommended specialist did not need to see this woman to do the surgery for her daughter, right? And there's been reporting that UnitedHealthcare and Cigna, so we're not singling out UnitedHealthcare, but UnitedHealthcare and Cigna have a review system where they hire doctors to review claims. And in one instance, one doctor denied 120,000 claims in a 60-day period without even seeing the patients, just reading a file that UnitedHealthcare gave them. They can just click yes or no, claim denied.
I mean, and they probably didn't even read the file, right?
They didn't.
In 60 days, that's 2,000 cases per day.
Right. Who has time for that?
He or she did not, like, read the cases. They just clicked blanket, like, no denials.
Yeah, and that is part of what is happening here. And this system that we're talking about, UnitedHealthcare, was part of Brian's legacy at United. So, again, this is the problem. He and his industry have turned patients into just anonymous numbers or anonymous files or anonymous list of bullet points. They give it to another doctor who doesn't even review the case, doesn't have enough information, doesn't know this patient. That person declines the claim. You as the patient now have to get into an argument with your insurance company that you've been paying monthly about why you deserve care. And in the story you're sharing with me, which was on HuffPo, the family in question, they talked to a case manager after the surgery was declined. And the case manager said she supported the surgery, she approved the surgery, but then it had to go to a, quote, negotiations department. And the negotiations department spent 5 weeks basically saying they didn't get any paperwork and refusing to talk to the doctors. So this woman was still waiting for surgery for her daughter. I don't understand how we arrived at this point in American healthcare. But I am not surprised. Like you said, I'm not surprised.
I mean, it's even worse than what you are saying, right? Because the person who got to speak to a case manager, that's because they persevered, right? How this works is that they actually want most of us to submit our claims through the internet, where AI that they've already brought in just plugs in an algorithm and denies everybody. And apparently 90% of the time that AI denial is wrong, right? Because it's just an algorithm. It doesn't know, like, anything about the status of the patient. But that's what they want, right? And then anyone who's been through this sort of appeals process knows how soul-sucking it can be. Because you do it on the internet, you get denied, then you get on the phone, you're waiting 30 to 60 minutes to talk to a customer representative, who then has to link you to a case manager, who then has to link you to a nurse, who then has to link you to a negotiating sort of team, and then they have the gall to tell you that actually your physician hasn't sent in the paperwork, even though, like in the story that I shared to you, The physicians have already done all of that. You have to call the doctor's office back. They want you chasing your tail, and they want you to give up, right? Because they know that by the time you get through all of this, you're exhausted, right? Like that mother says they just paid for an MRI out of pocket because they could not deal with like the runaround they were being given, and that's their goal. Their goal is for you to give up and either pay out of pocket or just, I don't know, give up and die. Like, it's insane.
Yeah, and that's what the United Health Group CEO said was, I guess they would classify the surgery as, quote, unnecessary care. That's what he's guarding against. By denying her life-saving surgery, he and his company are protecting her from unnecessary care. It's phrases like that, it's terminology like that gets people really aggravated. And this is an issue that has united the left and the right. We didn't have this on our bingo cards for 2024, but people seem to be together on this one issue of health insurance companies. It's like everyone has a story. Like I said, everybody has a story of being denied care that a medical professional has told them they need. And then their insurance company says to them, I don't think so, and says no. And here we are.
Exactly. And it cuts through multiple, classes, from everybody below the poverty lines, the working classes to the middle classes. Everybody has a story. Like, even people with very good jobs, very good homes, very good assets, they are all like one serious illness away from going bankrupt. And this happens all the time.
Yeah. And along the lines of talking about CEOs, I don't know if you want to talk about the other topic we have today that might also spur a revolution, which is budget cuts.
Yes, this is the DOGE people, right?
Yes, that's this Elon Musk and Vivek Ramaswamy's new government Department of Government Efficiency. The last few days, they've been in D.C. meeting with Congress people, sort of discussing their plans to make cuts. I want to say the timeline for me has been funny. First of all, Elon said they were going to cut $2 trillion from the U.S. budget. That was what he said at first. And if you don't know, listeners, the U.S. budget is $4 trillion. So they were talking about cutting 50% of the budget, which would be impossible. As we've discussed before, 60% of the budget is mandatory spending. So there was no way mathematically to do this in the first place. But now it seems the target has lowered a little from $2 trillion. What is being reported now is that Elon says they want to cut about $500 billion in, quote, overspending. They say they want to cut programs whose funds were unauthorized by Congress. These are programs that come from a congressional budget office report. They say they want to cut those. Without getting deep into the way the U.S. government works, do we think this is possible in the first place? Some of this spending is actually useful. And if they have a target of $500 billion, the places where they could actually hit that number is things like Social Security, the VA, Medicare, Medicaid. Those are places where they would actually have to make cuts, places that Americans would not be happy with at all.
Yep. I mean, America's budget, the biggest spending goes to defense and then healthcare, right? And one thing Republicans love is they love funding the Pentagon, and they love cutting Medicare, healthcare benefits to veterans. They love cutting benefits to everyone else. So, but like, this is what is also making me angry about the reaction to the CEO's assassination and like broad daylight execution, which is horrible. And I don't understand why, if this is how everybody feels, why the fuck did y'all vote for the guy who doesn't have any health care plans at all, who's wanted to cut Obamacare, which provided health care to 50 million people, including his own vice president's family members who he said never had health care until Obama. He wants to cut that. And people voted for him. And now y'all are kicking on the internet and, laughing about somebody's murder when you could have just voted, appropriately. And this is something I feel like is missing. Like, a lot of men are angry that they can no longer afford, the 2 children, picket fence, a dog in the suburbs with good health care. And like, I feel like y'all would rather shoot someone in the street than just vote appropriately. Because I don't understand if this is how we all feel. If we all know someone who has died from either delayed healthcare, which is also just a denial of healthcare, right? Like, there are all the stories on TikTok where the approval came a day or 2 days after, like, the person died. If we all feel this way, why did you guys vote against your own interests just 3 weeks ago?
Well, I mean, I think the answer, and we've been saying this for a while, is they didn't think it was against their self-interest because people just don't pay attention. I know it's not the answer you want. I'm just telling you. This is why we've been talking about entering the find out phase. People are going to find out. We will all get a very, very solid lesson in how government actually works over the next few years. And I'm happy as a nation because this is a civics education that we all need. I think that's what the answer is. That's why they voted against their own self-interest, because they did not know. I will say, if DOGE actually makes budget cuts to things like the VA and Social Security, I think that French Revolution you talked about will be much closer. Much, much closer than any of us realize. Because there's no way. In the country with this many guns, I wouldn't be doing things that piss off, veterans, for example. I wouldn't do it. It just doesn't seem smart. But then, it's Elon, so who knows?
But, like, this is the problem, right? We just created a perfect society for this kind of clusterfuck. As you've mentioned, right? Like, everybody has guns. And for some reason, they all think that the way to resolve it is to, like, shoot people, like, instead of just, like, organizing. I wish, like, we all had the same energy, a month ago, right? Like, what are we hoping is going to happen? Because people remember, like, okay, all this eat at the rich stuff, get your jokes out. But that it wasn't just the rich who were guillotined, right? Like, it wasn't just Marie Antoinette. Like, they came for everybody eventually. And even Robespierre, I don't want to get into this, like, whole historical lesson.
I'm going to be honest. I have no idea who you just said. I'm going to raise my hand. I don't know who you're talking about.
The leader of the French Revolution.
Okay, thank you.
Getting assassinated anyways. Because, like, once you start the process of dehumanizing people, it just goes on and on, right? Because, like, where does it stop? Or, you also helped the aristocracy in some way. And also a lot of these populist revolutionaries end up being corrupt themselves, right? Like,
that's true.
They didn't distribute the mansions to the masses. They just seized it for themselves. And so the masses were like, what the hell? Like, you promised us a revolution, like, off with your head too. And that's how it goes. So, like, we have a civil society. Let's just vote civilly and resolve things, like, normally. I don't understand why everything has to be so hard to get across to people, unless it's going to be, like, in the form of a, short, like, TikTok joke. It seems like even people on the
joke.
Honestly, even people on the right, apparently Ben Shapiro's audiences are also, like, calling him out about, like,
oh, right. He tried to do this whole, the left is the one celebrating this murder. And people in his comments were like, no, it's not. Exactly. Everyone is celebrating.
But, like, the Democrats, it's the Bernie Sanders, it's the squad, the AOCs, the people like you guys have been taught to hate. Those are the people who actually want to give you universal health care. And you're, like, letting Fox News and Ben Shapiro, like, tell you that, some undeserving Black and brown people somewhere are getting health care instead of like facing the facts. And I keep like bringing this up, but if healthcare matters to all of you so much, like, why did you screw yourselves over?
Well, one of the comments we received, because we did post about this on TikTok and calling out that these budget cuts are probably going to be bad for a lot of people if they go through. And one of the comments was someone talking about illegal immigration. I think I just want to help everyone, because people don't seem to know how USCIS works. But USCIS funding, 96% of it comes from immigration fees that are paid by immigrants when they're filing for paperwork. So nobody, 4%. And for context, because I think numbers help, again, we've talked about the U.S. budget is $4 trillion. USCIS immigration budget is $6 billion. So a fraction, small fraction of the budget. But of that $6 billion, only 4% comes from the U.S. government. So if you want to do all of that math, I can't do the math right now, nobody is saving money by closing USCIS. That's not even remotely close. Even if we lower the bar, if we say Elon is only going to cut $500 billion, it's not $2 trillion, fine. Even if you shut down the USCIS, that's I don't know if you guys can do math, but that's nothing close to $500 billion. So again, people are saying things, zero understanding of how government works. They think they're just going to let all the, quote, illegal immigrants go, and that's going to save us a bunch of money. We don't even spend that much money on immigration anyway.
But, they've all been business pilled, right? I feel like all these people think that they are one great idea, one, networking event from becoming CEOs themselves, right? Like they all think they are Vivek and Elon Musk waiting to happen, which is never going to happen to them. But they have like business brain rot where like people say to them, oh, the government wastes money and isn't making any money. And they don't understand, like, actually, maybe the government shouldn't be making profit.
Right.
Right?
Right. It's not Walmart.
Exactly. The government is not an investment fund. It shouldn't be, like, showing you, like, record profits. It should be running services for people. Like nobody's asking the Pentagon, so how much have you brought in profits after we gave you like $500 billion, right? Because people understand that it's doing national security work. And once they say that, we don't ask any further questions. We're like, oh yeah, sounds important. Why aren't we doing that for like, no, but like it's true. Like why are we not doing that for welfare or like healthcare, right? Those things are important too. Why do we, like, people expect the United States Postal Service to be posting record profits. Like, no, it should get your Christmas gift to your grandmother in record time for like 2 cents. Like, that's it. That's all we need from the United States Postal Service. But like, people don't seem to understand the value of services. They only understand the value of profits.
Yes, and once again, as we have said multiple times on this podcast, you think the government spends too much. It is spending most of its spending on things like healthcare, Social Security, veterans programs. I cannot stress enough, even if we lay off every single government employee there is, and I'm including the Congress people in this, that is only a 4% part of the budget. Where else are you going to cut? You can't. It's just math. The math is not mathing. He being Trump and his people who are suddenly getting this whole, we're going to cut, people are going to lose access to services if this happens. There's just no way. The other option, they don't do any cuts and they lower taxes, further increasing the deficit, which is a more normal Republican thing to do, right? Lower taxes and then increase spending. That's what Republicans usually do. And we could still do that, right? But if we do the cuts, which is what they say they want, people are going to get in trouble. And you know who's not going to suffer? I'm willing to bet money that when Elon comes through with his little Sharpie to strike out things, he won't be removing any of his government contracts, right? Because why would he do that?
I mean, thank God you mentioned that, right? Because SpaceX is a government contractor that gets $1.2 billion from the government, right?
That's a cut. We could make that cut right now.
We should just make that cut right now. Right?
Why are we talking about healthcare? Let's do SpaceX's contract. There you go.
Exactly. And everybody who is cheering for this stuff, this is again the fallacy of businesses, rising from the ashes from mere sweat and blood of their founders and their CEOs. Unfortunately, I don't know who needs to hear this. Most major companies, nearly all of them are federal contractors to the government. The government is directly paying them hundreds of millions of dollars. Let me tell you how much the government pays UnitedHealth Group, $574 million. That's how much the government pays them to run their services, right? And that's how they keep people employed, and that's how they also get to keep their $1 million bonuses. And they keep telling you that, I wake up at 5 a.m. and I don't buy a latte and I don't buy a cappuccino, and that's why I'm a CEO.
Well,
get it together, people. Get it together.
Whoa, we got a little spicy here. I don't know if you can tell, but Olu is riled up on this topic. I don't blame you. It's infuriating and frustrating. And I'm not even that close to the healthcare industry. I can't imagine what it's like for people who work in this space every day and see these things happen, or people who are in government hearing their jobs being discussed they're just lines on a sheet. They're not people. I don't know what we have to look forward to next year. I'm not psychic. I can't tell you what's coming, but 2025 feels like it's going to be a ride. It's going to be a wild ride.
I honestly don't know how they're going to make all of this happen. And, I wish them best of luck, right? I see that people
Really?
No, I really, really do. I feel like people like Bernie Sanders say that they're going to work with them and, cap credit card interest at 10% and try to come up with a healthcare plan.
Sure.
And I really, really hope it works out for everybody, because clearly people are struggling, right? And the places where violence breeds the most is when people are in economically dire straits, right? Poverty breeds violence. And this is not a society I want to live in. I want to live in a society where we can resolve the issues that affect our lives at the ballot instead of at the end of a bullet, right? So, that is really where we should be at. So I really do hope that a bipartisan effort really does happen. I wouldn't be surprised that...
No, that's not going to happen. That is not going to happen.
In the background.
No.
But,
Girl, no.
I mean, clearly people are struggling and struggling hard. That's why they cannot, feel sympathetic in this situation.
Yeah, that's why there's no sympathy for UnitedHealthcare and its employees. And that's also why we are in the situation we're in with who's coming into the White House next year. I agree. People are struggling. The solution they've chosen, though, seems counterproductive. But, between these budget cuts and tariffs and Trump having like 25 billionaires in his cabinet, if you're a normal person, I'm not really seeing what convinced you to go this way. But, let's see how it goes. Let's see how it goes.
I mean, it's insane, right? If people said that, oh, we don't have enough jobs and our jobs are not paying us and we're all getting laid off. And then they're about to vote for people who are going to cut budgets to their companies. Like the federal government gives contracts to General Electric, AT&T, Verizon, Merck, SpaceX, as we've mentioned, like Dell Technologies, Pfizer, FedEx. These are BP. These are places that everybody works at, right? Like everybody works at these companies. If they cut federal contracts to those companies, guess what the CEO of those companies are going to do? They're going to cut your jobs. This is why
deep breath.
I feel like I'm spiraling.
No, it's okay. Don't spiral. Do not spiral. Do not spiral. It's okay. We will be okay. I mean, you and I specifically. I don't know. When I say we, I'm not talking about society, but you and I will be fine. We will be on this podcast. We will be with y'all in the new year. We will be okay. We will be okay. I don't want people spiraling. If you are a Democrat, liberal voter, you did your part in November and you should feel proud of that. Okay. I know we didn't win, but we did our job. Okay. I've been saying, let everybody find out. Let them find out. Stop protecting them and also stop spiraling over stuff. Okay. Maybe this will all be nonsense. I mean, Trump didn't get anything done his first term, so maybe it will all just be the same, all talk, no action. That is honestly the best case scenario if he just gets nothing done. So that's what we should at least be hoping for. But don't spiral. Don't get upset. I see people getting really riled up online who are liberals, who are sad about the budget cuts and upset that Trump has so many billionaires and it feels like the oligarchy is taking over. And, I see people saying oh, we're turning into Russia. No. Calm down, okay? Everyone take a chill pill. Calm down. You'll get through this. If you're listening to me, you'll get through this. Don't spiral.
I understand what you're saying. And, I had resigned myself. And then this story just broke my brain again because just the intellectual incoherence of what we say is wrong with our lives and how we vote, right? It does not follow. It does not compute. If these are the struggles that we are all facing, then why did we give the White House, the Senate, and the House of Representatives to the very people who are going to not address those issues?
Because of the eggs, Olu. Because of the eggs. It's the eggs. It's the eggs. It's the fluoride in the water. I'm going to list some things. It's eggs. It's fluoride in the water. It's the raw milk, which I don't know if you heard the story about the raw milk getting pasteurized now because of what's it called? Was it bird flu? Yes, yeah. Right. So, it's the raw milk, it's the fluoride in the water, it's the, what else? What were the reasons? It's Palestine. What were the other reasons? It's that she's Indian, she's not black, or she wasn't black, she was Indian. I'm trying to think of all the other reasons. I'm blanking now, but don't start down that path. We're just listing things out here. She was a woman, she was Biden's VP instead of being her own VP. I don't know how that would have worked. She didn't fix the border, even though she wasn't president. It was a bunch of things.
Okay.
It was a bunch of things.
Well, I feel like we have to end there, right?
Yes, let's not, because we might start a whole new episode. let's not do that.
Okay, thanks for joining us this week, folks. If you've enjoyed this episode, please make sure to share with your family or friends. We will see you next time. As always, we are Liberal Banter. You can find us at Instagram, Threads, TikTok, or visit our website at liberalbanter.com, where we actually have merch now. Bye-bye.